Prominent upper lobe vessels is an important radiological sign in mitral stenosis. This can be seen in other conditions with elevated left atrial pressure causing pulmonary venous hypertension as well. The features are actually due to pulmonary venous hypertension, and the vessels which are seen are pulmonary veins. Even though on X-ray it is difficult to say between arteries and veins, in this situation it is enlarged pulmonary veins. In conventional chest X-rays, standard old chest X-rays, they used to say that width more than 3 millimeter of these vessels is significant. And it is a well-known eponym that they are called antler sign. This is the antler. You can see the resemblance of the antler to these vessels. They are also known by other names like cephalization, because vessels are seen more in the upper zones rather than the lower zones. It is also sometimes called inverted mustache sign. Usually mustache is downwards and this is turned upwards. Inverted mustache sign. And redistribution, because normally due to gravity, vessels are more prominent in the lower zones, while in pulmonary venous hypertension, venoconstriction causes lower number of vascularity in lower zones and more vessels are seen in the upper zones. That is inverted mustache sign, antler sign, redistribution, cephalization, everything meaning the same only. We will also have a look at other features seen in this chest X-ray in a person with mitral stenosis. You can see that the right atrial border is shifted far away from the midline. In conventional X-rays, they would say more than 5.5 centimeter from the midline. But now we have miniature X-rays and we are always reading digital X-rays, so those measurements may not apply. This shifting of the right heart border to the right will indicate right atrial enlargement. And you can see a shadow within shadow, somewhat like that. It may not be very obvious on a video, and that is left atrial enlargement. Left atrium is a posterior structure and that can cause a double shadow. This is called double mitral, double atrial contour. Sometimes if the left atrium is aneurysmally dilated, it can go beyond the right atrial contour as well, but here it is not so. This is the left bronchus. Left bronchus, air in left bronchus can be seen on chest X-ray, and this is the carinal angle. This is the right bronchus, left bronchus. There will be widening of carinal angle because left bronchus is elevated and carinal angle is widened in left atrial enlargement. Typically in mitral stenosis, where there is chronic left atrial enlargement of large, sometimes in aneurysmal proportions. Features of pulmonary arterial hypertension are not very prominent here. We are not seeing a prominent bulge of the main pulmonary artery here, or the other branch pulmonary arteries are not very prominent. So this is predominantly pulmonary venous hypertension. Another feature which is not seen is the prominence of the left atrial appendage or the third mogul sign. The left atrial appendage can bulge out, causing a third mogul sign. First mogul is the aortic knuckle, second mogul is the main pulmonary artery, which can be prominent in mitral stenosis. Those features are not seen here. And absence of a prominent left atrial appendage shadow may mean that left atrial appendage was amputated during a previous mitral valve surgery, closed mitral valvotomy, in which to prevent thrombus formation, left atrial appendage is removed. And if the person comes with mitral restenosis later, the prominence of the left atrial appendage or the so-called third mogul sign may not be there. For completion's sake, we will discuss the other moguls which have been described in another chest X-ray. This is the first mogul, aortic knuckle. second mogul main pulmonary artery, third mogul left atrial appendage, fourth mogul the left ventricular apex or the cardiac apex, and a right-sided mogul, the right atrium, has also been described. Now, what is this moguls? They are snow moguls. When people on skiing slopes turn the ski at an acute or a sharp angle, moguls are formed in the snow. That is the mogul. So these moguls have a superficial resemblance to the snow moguls. That is how the name was given. We will discuss one more feature in mitral stenosis, popular Kerley B lines, horizontal lines near the costophrenic angle. They are thickened interlobular septa. And in addition to this, there could be Kerley A lines radiating from the hilum, linear lines. They are thought to be distended lymphatic channels. Then there could be a reticular pattern in this region known as Kerley C lines, thought to be end-on views. This is horizontal. Instead, if you have end-on views of the same thing, you can have reticular pattern in this region, Kerley C lines. So thanks a lot for viewing. We'll come out with another video soon.